Hey, happy Monday afternoon. Dr. Alan Christensen here with you. Welcome to Office Hours Live. Okay, good to be with you. I'm with you guys on Facebook, on Instagram, on YouTube, and I'm seeing a lot of you all jump on already, and that's super cool. So good to be here with you. Let me just adjust a few things so I can see everything going on here properly. Okay, there we go. I'm going to watch for all the chat going on too. Okay, now I can see more of it. Yeah. So as you're getting on, say hi. I'm seeing many coming on already. Holly's here. Holistic Living with Danielle is here. Welcome, welcome, you guys. Good to see you. Let me know where you're from. If there are top health things you're wondering about these days, especially related to food, metabolism, thyroid health, hormone health. Let's talk about that. Let's make a bit of a difference for you. I've really come to believe that your quality of health is your quality of life. You know, if there's things that are holding you back from feeling your best, you can't think about anything else. You know, you can't really be your best. You know, life is just not the same. When I was a kid, I was pretty obese at one point. I had complications from cerebral palsy. I had seizures. And when I was 12, out of desperation and just being tired of being humiliated, I started reading health books, and it completely changed my life. You know, it made me believe that one was that, yeah, your health determined your life. The right information could transform your health. And you didn't always know where the right information was going to come from. So you had to be open and learn and check out some sources. Then you had to do it. You had to really implement it. But it made me want to go into natural medicine. And that was a long time ago, and very passionate about this message still. And I love hearing about how much the body can change, how much the body can heal. So always know that it can. You'd be surprised. I'm still amazed to learn about things that I didn't think could heal easily, but can heal. And the body can repair itself. So yeah, never give up. That's the message. And here at Office Hours, I love to go deeper with you on the topics. Over the years, when I first got into this, anything you could hear about health advice was like gold because nothing existed. And we've gotten more and more of it. That's great. But now the trick is, how do we discern? How do we filter? How do we sort through the data to figure out what's most useful and what's most useful for you? And you can Google any topic and find thousands of pages, but how does that apply? How do you really make sense of that at an individual level? So that's what Office Hours Live is about. I can take questions. I can talk about that. I won't be prescribing or treating, obviously, but we can talk in more depth than you would find otherwise. Some of you all have sent in some great questions already, and I'll throw those in as we go. And if we see some live ones, that's awesome. We'll do some of those too. If you do put a question up, hang out, because I'll often have some follow-up questions so we can have a bit of a conversation going. So yeah, a lot of you are coming on. Welcome, welcome. Yeah, and any of the platforms, put the notes in. We've got Fran here from Boca Raton. We've got someone here from Montreal. That's cool. That's not too far from up north, northern Minnesota here. And I always see a lot of doctors, a lot of practitioners coming on these days too. And you're totally welcome as practitioners. If you have questions about your cases, I'll do my best to cover those. Practitioners, it's worth knowing that I'm also doing some webinars for you all. And if you go over to thyroidspecificformulations.com and look at the practitioner portal, if you sign in for that, if you sign in for a practitioner account, you will be in the loop on our practitioner webinars. We just did one on how to individualize iodine, how to know if your patients need more or less, and how to really adjust that specifically. And we did one before that on all things managing thyroid antibodies, and one coming up on diet therapy for thyroid disease. That's over at thyroidspecificformulations.com on the practitioner portal. We've got friends joining us here from England. Yeah, just a quick note. One of our friends from England saying thyroid cure is not the best, not great. Changing my diet has given me the best outcomes. That's really cool. And something that has been a big, I don't know, some big shifts in perspective in my world has been that, yeah, thyroid disease is more reversible than we thought, and diet can do more than we thought, and medications can do less than we thought. So those are all things that I've been integrating into what I share, especially these last few years. Medications, They certainly are needed. They're life-saving for some, but for most people with most versions of thyroid disease, they're not going to help. And it's not a matter of the wrong medicine or the wrong type. They're just not going to be useful. So we can talk about that too. How can someone deprescribe? Do they need to start medications or not? I can give discussions about that as well. Okay, so some good questions coming in. There's some that we'll talk about here. This is one, I've seen this one a few times before about fasting glucose and insulin and A1C not making sense. We can talk about that. Oh, here's someone else from Arizona. This is cool. Daily shakes recommended. Which one are your daily shakes recommended for the thyroid reset diet and the adrenal reset, or just for metabolism reset? That's the easy one, Danielle. They're great for any of those. They can work for all of those diets, all those programs. So yeah, glad to help with that one, and good to see another Arizona resident nearby. Question about getting off levothyroxine. Erica's asking that. Erica, if you want to put more details on the dosage you're on, the duration, what your diagnosis was, I'm happy to talk about that. In many cases, the answer is yes, but the more details that you feel okay about sharing, the more precise I can give an answer for you personally. Vivian's asking about chlorine. Does it affect things with the thyroid? We'll talk about that one too. Okay, so a lot of good questions are rolling in, and I gotta do as many of these as I possibly can, because that's what this is all about. So let me do a couple that were sent in advance because they were really interesting. I'm just going to jump through these real quick. I promised to cover this one. So this is one, I've talked about this thing about B6. So pyridoxine HCl is a synthetic version of B6, and dosages somewhere above 10 milligrams per day can get really toxic for some people. They can cause major fatigue, anxiety, depression, nerve pain, like numbness and tingling, like a really big deal. And, vitamins, the idea was that the more the better. And if there's something bad, you need higher and higher amounts. Now, there are many times to where they're needed. And in most cases, they are safe at a big dosage range. But sometimes you can get too much. A gentleman wrote in talking about he thought that he was vaccine injured, but it turned out he had B6 toxicity. He had neurologic problems. He had nerve pain from this. And he found a lot of ways in which he was getting massive amounts of B6 and B vitamins. So now he's a couple months out of avoiding these big sources, but the blood levels are still high. And he's wondering what else can be happening. What else can he do to clear these out? Well, yeah. So Evan, thank you for that. So B6 in lower doses for most people is not a problem, but the further you get north of 10 milligrams for some people, it can be neurotoxic. Now, there's a version called pyridoxal 5-phosphatase, and there's a version called pyridoxine hydrochloride. The pyridoxal 5-phosphatase is a type that we find more so in foods, and our body makes that. So that type doesn't really have the toxicity. But the pyridoxine HCl in higher amounts can be toxic for some. How long will those blood levels stay high? Well, they can stay high for several months. So, my friend, you're on the outside of that. They should be coming down rather promptly. Otherwise, we'd think about other sources. Now, there has been an argument that other B vitamins may prolong the clearance of pyridoxine HCl. So, if you are getting high amounts of riboflavin or niacin, especially, but also some of the others, they can delay the excretion. The breakdown of B vitamins is common. And what we're seeing now in my newer supplements and other lines is lower amounts of B vitamins. We do need them, but there's many circumstances in which smaller amounts can work better for people. And Evan's question is a great example of that. Evan, if you're still around, you want to ask more detail, I'll keep an eye open for that. You put your question up in Insta, so I'll watch for that for you and happy to address those more specifically. Related one, how does one send questions in advance? Frankie is asking. Frankie, you're with us on YouTube. If you visit either Facebook or Instagram and at Dr. Alan Christensen, there's always places for that. You can put it in any comment, but the day before we go live on office hours, the team always puts out a post saying, hey, are there some questions to put up? So that's the best place for that. Related one too, quick one. Danielle, my husband wants to ask you if you do individual consults. We would love your help with my Hashimoto's since we are local to you and prefer naturopathy and homeopathy to allopathy. So Danielle, yeah, great one. So a couple of options for that. So and I see Evan's comment. We'll continue to wait and be patient. Yeah, Evan, watch the other B vitamins. You're doing a lot of healthy stuff. I think you're going to do okay. Look at it again, maybe a month or so out, and jump on back. Let us know how you're coming with that. Uh, Evan, you mentioned some neurologic symptoms. One point that I wouldn't want to neglect is that it may take there's the duration, how long it'll take for the B6 levels to get low. Then there's how long it'll take for the related neurologic symptoms to go away. They're not the same thing. There might be a lag after your levels go low, and it could be several months. You should start seeing some improvement in the first few months, but it may take a while for symptoms of nerve injury to completely resolve. So if you're a month or so out, your levels are low, and your symptoms are barely improving, don't lose hope. That's about the time frame that could be typical. All right. Danielle was asking about consults. How can we help in person? Totally glad to help, Danielle. So, two options. One can talk to me directly as a personal consult, and that can be anyone, anywhere, wherever you live. That's fine. I'm going to drop a note up here. I'm going to put a comment in. Let me get going here on. Yeah. All right. On Facebook and YouTube, you'll see this. This is at thyroidopinion.com. And there you can speak to me personally. The other great option is that in Arizona, you can work in person, speak to me personally virtually, if that makes sense. In person, my team is in Scottsdale and they are at Integrative Health, integrativhealthcare.com. Boom. Spelling is tricky sometimes. But yeah, they're happy to do all facets of thyroid care. I practiced with them for 20 years. I still oversee things. We do case reviews, and we've got 3 excellent doctors in place. So they can do prescribing, they can help manage dose deprescribing when it's appropriate, ultrasound tests, all facets of thyroid care. They can cover that in person. So Danielle, a couple of options there. Happy to help out there, whatever works best for you. Okay, I want to get 1 or 2 more of these other questions before real quick. Kathy, dear friend Kathy, had this one. I want to address it about liver health and appendix. Quickie here, Kathy. So the appendix we now know is, well, one thing we think is that it is a built-in probiotic. So it's kind of like your own little time-release probiotic that releases good bacteria. And there's data saying that when the appendix is inflamed, that shows up by altered liver function. When it's irritated, a lot of junk from bacteria, a lot of endotoxins, they hit straight in the portal vein, they hit your liver, and we see changes in bilirubin and liver cell death. So that's a connection. As far as how that plays out over longer term health, not so much clear on that, but definitely when the appendix is acutely inflamed, that does affect the liver. Okay. I had 1 or 2 more that I want to mention, and I will come back to those. But let me just jump on a few others. There's been so many good questions sent in. So welcome. Many of you are just coming on. Please say hi. Tell me where you're from. Always curious about that. This is Office Hours Live, Dr. Alan Christensen. So let's talk about food, metabolism, hormones, health, thyroid, any of those sorts of things. We've got great questions. I love to give deep, detailed answers, and I love to get questions that relate to other questions so we can talk about things at a level you wouldn't hear otherwise. So I'm going back. Joanne's asking, hey, Joanne, when does the next metabolism reset start? Joanne, I don't have the exact date top of mind, but I'm pretty sure we'll have one early November. So it should be early November, close to there. So stay tuned. Metabolism Reset Diet, if you look at that URL or Facebook, go to the Metabolism Reset Challenge group. Joanne's talking about a free challenge we do most months. And that's a free 7-day starter challenge towards the 28-day Metabolism Reset Challenge. Actually, I did an interview a couple of days ago with a gal, and there's a podcast coming out about this. She's down 65 pounds from not one, but a couple rounds in the Metabolism Reset Challenge. So super powerful. And she's one to where nothing had worked for her before for weight loss. Even her first attempt at the Metabolism Reset, she thought she was going to throw in the towel, but she stuck with it and it's been just transformative. So it's a cool thing. I'm really proud of that. Okay, Erica, back to yours. Is there a way to get off levothyroxine after 20 years? And you dropped in more detail. I've been on 75 micrograms. I've taken it since 2000, diagnosed after the birth of my third child. So Erica, so the question is about a topic I call de-prescribing. I didn't make the word up, but de-prescribing, coming off of a medication, in this case, thyroid medication. So you're on 75 micrograms. So Erica, some quick context, assuming your gender, assuming you're female, women's bodies require somewhere around 7 or 8 tenths of a microgram of T4 per pound of body weight. So quick math, so 75 micrograms, you would need that much if your body, that would be everything you would need if you were about 100 pounds, around 100 pounds. So if you were very, very small, like about that size, and your levels were stable at 75, that could mean you were making none. Now, assuming your levels are stable, and most adults are over 100 pounds, so the more you are above 100 pounds, then the more you're making by yourself. Here's perhaps a silly example, but if someone needed that for 100 pounds, if they were 200 pounds and they were stable on that much, that would mean they were making half of their needs. Their thyroid was only compromised by half. But basically, by knowing about your body size, you can know about how much you're making. And the more you're making, the more likely you could make all of it, the more likely your thyroid could take over by itself. The other question is, how far things along were at your time of diagnosis? And for many people, this is not clear. You went on that after your child, you said, so after a pregnancy. It's quite common that there are alterations of thyroid hormones during or after pregnancy that are not permanent, that are not long lasting. So the dosage that you told me, and that you said that this happened after pregnancy, those are both things that make it more likely and more possible that you would not need that long term, that you could possibly come off of that. We've got someone with us from Tasmania, from Los Angeles, from South Florida. That's really cool. That's really exotic. Love to visit Tasmania someday. So, Erica, I'm going to drop a link up. This is one of the more recent papers I've written about de-prescribing. Let me get this one ready. And this talked through some of the ins and outs of that. And, this is done with the guidance and blessing of one's prescriber. But the upshot is that for the majority of people, they can do fine on less, and many can do fine on none. And by doing fine, I mean not regaining symptoms, in many cases improving symptoms, and not getting abnormal thyroid levels. So very possible, much more so than we thought in the past. Let's see. Several more good questions. I've got a few more queued up also. Let me just glance over, make sure that I'm sharing things well across the board. Yeah, many jumping on here on Instagram. So here's a good question over there. Is there anything in the Jen is asking, is there anything in the Daily Reset shake that can change the odor of one's sweat, specifically onion garlic? I noticed it lessens when I abstain from the shake for a couple of days. Jen's awesome question, not one I've heard before. Things that change the odor of one's sweat. We do know that, of course, garlic can do that. We can see that fish proteins can do that. Sometimes high amounts of egg proteins can as well. But in shake ingredients, not ones that we would expect. And this, I wouldn't say it's not possible, but it's something that I would wonder if there's another variable. Sometimes, this is interesting. Yeah, sometimes during weight loss, there's higher amounts of uric acid that's excreted, and that can change the odor of someone's sweat. It's funny, but there's a lot of ways in which, even though weight loss is ridiculously healthy and ridiculously helpful, it is a stressor on the body in the moment. And there are ways that the body works differently during that process of weight loss. And I've heard many mention that, like, as they're breaking down stored fat, sometimes they notice that their body odor changes. So yeah, I wouldn't think of that, Jen, as necessarily an ongoing thing you should expect from the shake, but some do notice that temporary during processes of weight loss. So yeah, think that through and let us know if that makes some sense, or if there's any more variables you understand about that. And to Evan's comment too, to wind back a little bit, the discussion about B6, I wanted to share a link of an article that I wrote that I think inspired Evan's question, if others might find that useful. So here is the one about the de-prescribing for Erica. And this was the one about the B6. That's going to be visible on the Facebook and YouTube links. So yeah, okay. I'm just refreshing one screen here. There we go. And now, if I do this right, I'll be able to also properly share some of these links over on Instagram. Yeah. Here's the one for Instagram about the B6, about the relevance of B6. Others might find that. And now I've got to turn off the volume on that one, so I'm not getting feedback going. Okay. Erica, thank you. We'll read that for sure. So related question, follow-up question about deprescribing. Frankie had one. I'm 68, 118 pounds, currently working on deprescribing slowly. Suggests that my comes back with roughly 71.4% of my body's needs. Does that mean my NDT dose is still too high? So Frankie, what that means is you're making about 29% and your dose is 71%. It doesn't mean the dose is inherently too high. It means that the dose makes up about 70% of what your body requires. So you are making some, and that's good. If a dose is far above 100%, it's pretty much always going to be too high. That's straightforward. And what Frankie is talking about, the thyroid quiz at thethyroidquiz.com, that will walk you through some questions and help you know how much hormone your thyroid is making. That's a cool thing to be aware of. So yeah. Question here, please talk about Graves' disease from Thoughtful Pro and Dr. X. So Dr. C, I'm guessing C and X, they're right next to each other. That could be an easy typo. So yeah, if there were detailed questions you had about Graves' disease, please do put those. I'm happy to cover those. I could talk a lot about it in general, but I've written about it in general, but I'd love to know exactly what you're wondering, and I'm happy to address that. So I'll keep my eyes open, Thoughtful Pro. If you want to drop some more detail in, let's talk a bit about Graves' disease. Okay, so I'm scrolling through. Yeah, Jen, okay, track some other things as well, see if there's any connection. Yeah, think that through a bit. Questions that were sent in advance. There's a couple more good ones, and I wanted to get to this one here as well. So Anik was asking this, might be able to expand a story you posted recently about going too low carb for afternoon and evening meals and how it can cause yeast issues. I'd like to better understand that, why and how in this issue, please. Yeah, so low carb and yeast. So, funny thing, in terms of carbs and fats and all that stuff, they're fuel sources. Neither are magic tonics and neither are dangerous toxins. They're both things we need to have in our diets. And there's a lot of people who could go a little higher on one, a little lower on the other, and do totally fine, or reduce both, do totally fine. But we need some of each. They're good things. Now, they all have some unique properties. So fats are the sources of some essential fats that we don't get outside of them. And they also allow us to properly absorb fat-soluble vitamins. So we need them. Now, carbs superpower, big thing there is they're fiber. So all things fiber are carbohydrate. And we know fibers are super important. There's many kinds of them. A lack of fibers starves the bowel flora. And some people, that may lower digestive symptoms for a while. It's really common to have dysbiosis to where you've got a lot of the wrong bugs. And if you starve the bowel flora across the board, you may calm down and reduce some of those bad bugs, and it may feel better. But it's worth knowing that that's a short-term strategy. You got weeds in your garden, so you turn off the water. Yeah, the weeds will reduce, but the whole garden's going to die. And that's a drawback about extreme low carbohydrate, is that you have no good food for your healthy flora. And it's like taking an antibiotic. So when you deplete your good flora, a lot of bad things that don't depend on quite as much can overgrow. And yeast is like that. So that's the very simple connection between yeast and carbohydrate. Now, you talked about time of day. The relevance there is that some people who have cortisol levels too high at night, they can improve that by including some healthy carbohydrate. Carbohydrate allows a reduction of cortisol. Cortisol is a glucocorticoid. It's a glucose regulating hormone. And in a lack of carbohydrate, we make extra cortisol to break down muscle tissue and make it into glucose. So simple connection that way too. All right, a lot of really good questions coming in live, you guys. Thank you for that. Yeah, I'm seeing several here. And I'm going to jump around. It's going to be tough to choose, but I want to get a few more threads to start some discussions on. So please forgive me while I take just a minute and look for those. So many more doctors coming on. Welcome, welcome. And doctors, you're welcome also to drop in cases you may have questions about or just other more technical questions you have. And doctors also, there's some webinars going on right now. You can go to thyroidspecificformulations.com and look at the practitioner portion, sign up for a practitioner account. And we've got a series of webinars going on for you all in great detail. One coming up on how to implement dietary therapy simply and easily to help your patients do better. Diet therapy is not just a good idea, it's like the idea for reversing thyroid disease. Medicines don't work in the ways that we used to think. Okay, scrolling around here. This is interesting. So Rita is asking a great question. She's asking, a menopausal woman's ferritin is low, 8, always been low. Rest of iron test results are normal. Would you recommend iron supplementation or not? Rita, yeah, good question. Iron's such a big deal. And I want to share a link with you all about a detailed blog I wrote about this. I'll give you a really good answer right now, and there'll be more depth in this blog. And there's some really cool tools in this blog you can use as well. If I can get, here we go. Ellen Christensen, iron. There we go. Okay. Yep, this is the one. This is cool. Okay, so this has the iron cycle and a lot of other useful things. I'm going to put that there, and I'm going to share that also on Instagram. Get this one back up. Here we go. Okay, here's the iron link. So the short version of that, yes, there are some complexities to reading iron levels, but in many cases, the first thing to dip is ferritin. There's a thing called latent iron depletion, and that can occur with normal serum iron, normal hemoglobin, normal hematocrit, normal transferrin, but with ferritin being below range. So ferritin is a stored form of iron, mostly stored in the liver. And at low levels of iron, one of the first things that can happen is it can drop. So how low is low? Well, the tricky thing is that there's not a perfect number, but if someone does have unexplained symptoms that can be iron related, then we think about iron differently. We think about it being relevant even if it's normal. One paper looked at those with thyroid disease specifically. It turns out that thyroid disease changes the requirements for iron. Because a lot of the thyroid enzymes are heme dependent, a lot of the use of thyroid hormones is heme dependent, subtle iron deficiencies can be more of a big deal than they would be otherwise. But this paper showed that unresolved fatigue and hair loss could occur when ferritin levels dipped somewhere below 50 or 60. And the weird thing is they could show up there, but they may not resolve until iron elevated greater than 90 or 100 as far as ferritin goes. So that can be a tie-in. But yes, Rita, if you take a look at that link that I put up there, it'll give you some good tools. You can see not only the exact category of an iron deficiency you might be in based upon your labs, but how much iron you would need to replete that. Now, another really exciting thing that I'm jazzed about, people have struggled for a long time to build up iron when it's low. And there's been really good data about how iron absorbs, why it doesn't absorb well, how it can absorb better, how much iron you need, what can go with iron. But basically, I made a really good version of iron that people can often take just one a day and reverse low iron levels safely. And this has been true for a lot of people that could never raise iron before with oral supplementation. Many had to do high dose IV. But this is called Easy Iron, and it's a therapeutic dose of iron in a single capsule, which is kind of unique. But it's the first time I've ever seen to use citric acid and piperine as cofactors. It does include vitamin C. Others have included that. But vitamin C, piperine, and citric acid, for different reasons each, all make iron better absorbed and better tolerated. So people to whom it bothered their stomach or to whom it just didn't work, this one can work. It's got a natural plant-based version of iron called ferrous fumarate in a therapeutic amount of 100 milligrams per capsule, plus all the cofactors in the right amounts. So really jazzed about that. Cost effective, one a day, super easy to take. You can take it with meals, which is easier on the stomach too, but that's been a great solution for those who run low in iron. Um, Jody, thank you for repeating. I think you put your question up before. So Jody's asking, if is thyroid function directly related to cholesterol? Had a TSH of 3, was prescribed thyroid, got more extensive blood tests, and have high cholesterol. Hi from Arizona. Hey, Jody, right back at you. It can be. Now, a TSH of 3, this is interesting. There is data saying that that can cause symptoms and that can raise risks. There's also a lot of data now showing that medications can be hit or miss until things are very far along. But dietary approaches can work very consistently. So high TSH can correlate with higher cholesterol. There are people who, of course, can have high cholesterol for reasons that have nothing to do with their thyroid. But if your cholesterol is always stable and then your thyroid drops off and your cholesterol goes up, that can happen. And in many cases, then reversing the thyroid problems can often help cholesterol. Now, the deeper question is, does it still help heart disease? And this is one of the areas to where the perspective on medications is newer. It seems that even when medications lower the TSH and lower cholesterol, they may not lower the heart disease risk. But if you can reverse things naturally, that's different. Then you can have a better effect upon the heart disease risk. And all along, we all want to not need pills. We all want our bodies to work normally again. That's why I'm so jazzed about the thyroid reset diet and the program in that. It's been clinically shown to reverse hypothyroidism, subclinical hypothyroidism, and Hashimoto's thyroiditis. And it's worked in upwards of 95% of those who have followed the guidelines. So one study showed 78% efficacy, and that was full disease reversal. But of the 22 some odd percent that didn't fully reverse the disease, most of them radically improved, or those that didn't, most were not compliant. So it's only 3% who were compliant that didn't fully reverse disease or radically improve disease. So we can do a lot more than we thought with diet for thyroid function. And that's really cool. Lots more good questions. Let's grab one or two more, and I'll look for some follow-up ones for starters, if I can go in more depth about ones we've already covered. Here's a follow-up from Rita. Thanks, doctor. I'm going to study the data you shared here. Iron supplementation was very controversial. Yeah, Rita, in the context that I discussed it, not really. Yeah, there's controversies. There are some situations, many, in which iron is not needed, and there are some debates about the relevance of those. And the other thing about iron that can be tricky is that ferritin can elevate falsely due to inflammation. So there are those who may be low in iron but have high ferritin, and a real common cause of that is fatty liver. Other types of autoimmune disease can cause that as well. So there are a lot of edge scenarios like that. And sometimes I've seen those mistakenly called iron overload. And that happens too, but more often than not, it's often not iron overload. It's often just inflammation raising ferritin. When the body's inflamed, more iron moves out of circulation and into storage, and ferritin gets pushed up, while the other iron markers do not. And iron overload looks a little different. But those things can be unclear to some clinicians. But yeah, there shouldn't be a big controversy about supplementing iron for what you're describing is generally called latent iron depletion. And I explained that really well in that blog post. And treating it with iron, not really a controversial thing, unless someone just doesn't really understand, if a doctor doesn't understand that at all, perhaps, but no real drawback. And there's many situations people just don't need iron at all. Those who are not low in it. And in those cases, they shouldn't supplement with iron. That's totally true. But yeah, no real controversy about iron for latent iron depletion. Let's see. Here's a really good question. I'm just going to scroll around and see how current I am on other ones and see if there's any follow-up comments that came in, because those are always the most useful for us. Here's one. Karen had a quick one. I've never received an answer as to, can I reset my thyroid if I had it irradiated? Yeah, great question, Karen. So if it was irradiated, so that's most commonly done for Graves' disease. And the radiation, sometimes they attempt to do it in a way to partially shut it down, but not stop it completely. If that's successful, there's some remnant thyroid function occurring. If that's unsuccessful, there may be a complete breakdown of thyroid output. So the first question, Karen, is how much is your thyroid making by itself? And I mentioned briefly about the thyroid quiz. If you look at thethyroidquiz.com, there's some questions it'll ask you, and it can help guide you to see how much hormone it's making right now. And Karen, the idea is just knowing one's weight, one's dosage. And from there, assuming you've got stable blood levels, you can see how much output your gland is making. If it's making the more it's making, the more likely it can make more. If it's making none, it's questionable. That doesn't mean that it can't. But overall, there are many to where it was radiated but not totally shut down. So it still can be possible based upon how much it's doing. Great one here from CR. Let's get one or two more questions. I'm cooking a dish. My Karen was doing some errands to help with my mom today as I was here doing these things. And I want to make a real nice dinner for her tonight. So it's going to be a Greek eggplant dish is what it is. Yeah, this is going to be really awesome. So we got eggplant and some chickpeas. And I'm right now simmering them on the pot. They're going to go in the oven and bake for a little bit, but they're seasoned with crushed tomatoes and coriander and cinnamon, bay leaves, turmeric, and oregano and garlic, some fresh garlic. Some of you guys just got some garlic from Five Sisters Organics, and that was the family farm. That's the garlic that I've got, and it's incredible. I think they still, I don't know if they have any or not. They probably, I'm not sure. But each year, somewhere around August, they have a big crop of garlic. And I share that with those on the email list and say, hey, look, here it is. And so we get a bunch. They send us some too. And it keeps for 6 months or more if you store it in the right conditions. But it's just awesome garlic. But anyway, that's what I'm smelling. That's what's on the stove. So that's going to be a good dinner. But back to this good question from CR. I'm investigating the connection between thyroid dysfunction, in my case a nodule, and adrenal fatigue. Could you please address this? Thanks. For sure. And I'm going to see if I can't pull up. I think I've got some good articles on this as well. And let's see if I can't just do both. Thyroid, adrenal. Let's see. There's a couple different good ones here. I wanted to start with this one. We'll talk about this one. So the basic idea is that, yes, these things do relate. The one can affect the other. And adrenal fatigue, I think it's good to have some context that this is rarely a condition where the adrenals are damaged or broken down. It's generally a matter of the hypothalamic pituitary axis being disrupted by chronic stress. So I've called this adrenal stress, adrenal dysfunction, or HPA dysregulation, and these are all real, and these can interact with thyroid disease. Having said that, thyroid nodules are things that are common. Many do have those. So there are connections that way. The adrenals make this cycle of cortisol. There's this morning burst and this nighttime shutoff. If that cycle is not working right, the thyroid hormones can't get inside of the cells properly. So you need one for the other. Vice versa, sometimes when thyroid levels are very abnormal, the body will deliberately goof up the cortisol cycle to try to block thyroid hormones from getting in if there's too many of them. So that's just a couple ways they can relate. There are more, but there is an article that I'll share that talks more about that. I'm going to drop that link up here for everyone. And there it is. Okay. So let's get one more question. There's a lot of folks coming on still. Welcome, Office Hours Live. We're winding down in the next couple minutes. But here was a detailed one. Oh, here's a simple one. Jody's asking, how long can a person take the antibody support supplement? Do I need a break from it? You don't. You don't need to take a break from that, Jody. And antibody support, antibodies in general, they are big factors of symptoms. And this is interesting. In many cases, thyroid levels, I'm going to get a link to that up there. Thyroid levels surprisingly don't always affect symptoms as much as you would think, but the antibodies can. There's clear data that even when thyroid levels are healthy, abnormal thyroid antibodies can cause fatigue, weight gain, hair loss, infertility, heart disease risk, all sorts of problems. So antibody support is all clinical proven things that lower antibodies, and they do that well. They do that safely. In terms of durations, though, these are all things that are food-like substances. None of them are foreign or unusual. This is a blend of Nigella, inositol, and selenium. Inositol is a B vitamin-like substance that we require. We make some, but we can't always make enough. Selenium, we know about that. It's a healthy mineral. Nigella is a food-like compound called black cumin, and that's been used for thousands of years as a staple food in much of the world. So these are things that can be safely used for longer periods of time without a real problem. Okay, follow-up one, Rita saying, quoting my doc, do you want to cause more inflammation by taking iron? You are not iron deficient, so I've been digging into it. Thanks again. Yeah, so and the partial truth there is that that inflammation can raise iron, but vice versa, not so much. So when your body's inflamed, that can cause raising iron. It really means redistributing iron. There's not more iron in your body due to inflammation, but iron moves around in your body due to inflammation. And specifically, it moves out of circulation and into storage, thus the high ferritin. Now, does that mean that iron causes inflammation? Well, everything we need in certain amounts. And if we don't need iron, we're better off not taking it. But the people at risk from taking iron unnecessarily are mostly those with a genetic condition called hemochromatosis. The body normally adjusts how much iron we absorb. And if we consume more than we need, we absorb less than that. But a subset of people cannot adjust that properly. And they do build up too much iron, and that excess does become pro inflammatory. But that doesn't mean that iron at all levels for all people raises inflammation. In many cases, it's quite needed. But yeah, please enjoy the article, Rita, and hope you find that useful. Okay, so I think this will be our last one. Welcome, Functional Med PA. Yeah, lots of practitioners come on. So visit thyroidspecificformulations.com and then look at the provider section. There's some webinars we've got going on. There's also a thyroid practitioner forum that we're setting up, which is a free thing to join. And we do case reviews, we do literature updates. So lots of things for practitioners, but start at thyroidspecificformulations.com/providers. In fact, I'll get that link up for you guys to make that easier. Okay, so there's that. And then, yeah, so here's links about provider training. There's some things that are already up and available, and more things for those who become a TSF practitioner. And there's that. So lots of good stuff for providers. That's just more detailed, more case-based. So the other question that I wanted to get to is a detailed one that we had from Danielle. Danielle, severe Hashimoto's, diagnosed 2020, 8 millimeters of inflammation around the isthmus. I'm assuming that means nodule, but clear liver, clear kidneys, symptoms, can't lose weight, exhaustion, body pain. Danielle, these are the big ones, and super frustrating. The weight loss, the fatigue, they tie together. So here's the connection between weight struggles and fatigue. Your body breaks down stored fuel for energy. That's how we get energy. And that's also how we lose weight, by breaking down that energy. So when the breakdown doesn't happen, then both those consequences tie together. We can't get energy to move and do things, but also we can't break down the stored fuel. So yeah, weight gain and fatigue are two sides of the same coin, and they're super frustrating. Let's see. Body temperature, tried everything. Definitely in the boat too. General issue of T4, T3 are all normal range. Antibodies over 1300. TSH sensitivity is 29.7. Immune count. So Danielle, TSH sensitivity. Okay, so TSH high sensitive TSH you're talking about, I'm assuming. So your TSH is 29, T3 and T4 are normal, but antibodies are up. So Danielle, there's different guidelines. Most would call you being in overt hypothyroidism. Some would call you being in subclinical hypothyroidism. Danielle, I hope you're here. I hope you can post some follow-up comments. I'm assuming, okay, yes. So yes, your TSH is 29. So a lot of you folks know this. The TSH is a backward marker. The higher it is, the more the thyroid requires being yelled at to work. So in Danielle's case, her TSH is 29. Normal range is 4.5. She's way above that. Her T4 and T3 are still normal. What that means is her thyroid is making hormone. She's not yet thyroid deficient, but it's getting yelled at really hard to do that. So it's working uphill. So in these cases, many are quick to use thyroid medications. This is where their results can be hit or miss. Now, she has high antibodies. She has over 1,300. And honestly, whether it's TPO or TG or both, it's all the same. That's enough to cause these symptoms and cause many of these problems. So where you are, there's a really good chance of lowering that and improving the TSH by regulating iodine. Danielle, there was a study that was done with people with blood levels pretty much exactly like yours. Actually, the average score in the study was 22. Many were higher than yours. And for 8 weeks, they went on what I put into the thyroid reset diet. They did a low iodine diet. Within 8 weeks, the average TSH score was down to 5. Now, 5 is not perfect, but it's a whole lot better than 22 to 50. So it radically lowered. And the following weeks, it normalized for nearly everyone. And the antibodies, they can improve as well from the same steps. I talked a bit before about antibody support. That's the nutraceutical blend that helps to lower the antibodies. But I would highly encourage looking at that and considering the thyroid reset diet, my last book. But where you are, there's a good chance of those things improving. And the antibodies as they are and the stress on your thyroid, those are things that are holding back the ability to lose weight and have proper energy. Now, going on medications in those circumstances, that's a judgment call. And there's some that could encourage that, some that would not, different guidelines. But whether you do or not, the steps that I mentioned about considering nutraceuticals to support reducing the antibodies and looking at dietary therapy to help the thyroid, you've got upwards of a 95% chance of improvement in those cases. So you can do a lot better. And diet, lifestyle, natural compounds, they're powerful. I've practiced medicine nonstop as a prescriber for 20 years, and I've been in this world now for coming up on 30 years. But diet and lifestyle are the big deals. They make the largest difference in your health in this case. So I have your 3 books for the resets. So if thyroid is your recommendation, then I'll do it. What are the supplements I need? Yeah, Danielle, super easy. Consider I'll give you an exact link here. The Hashimoto's bundle is the best place to start to cover the bases. And actually that you're going to include that. You'll get those same things with the energy weight loss bundle. And that's going to give you the quickest head start for your specific symptoms. So yeah, consider that. Shakes are a great fit too. They're at drchristiansen.com, where these items are over at shop thyroid specific formulations. But consider those. And the shakes, even think about coming back to weight loss efforts after you've seen your thyroid markers improve. You'll get more results from that. The shakes for breakfast are great to start with now, but consider the metabolism reset ideas a couple months down the road when your thyroid numbers have gotten better. You'll get a lot more out of it. But yeah, keep us posted. Come back and let us know how you do. I think you can do so much better. Take a 5 any day. Okay, yes, TP. Okay, so that all made sense. Okay, so last one here. One more question. I was going to stop, but you guys, I got a bunch of y'all with me, and this is cool. And we're getting really good questions in. So let me get one more. Miriam, Danielle, perfect. I do appreciate you. Danielle, you're welcome. And keep us posted. I really want to hear how you do. Miriam, how does one safely test whether they can stop taking thyroid hormone or not? No antibodies, TSH 2.6, 15 micrograms tyrosine, VT3. Don't want to take thyroid medication if I don't have to. Help. So Miriam, let me get my deprescribe link back up to share that. And then I'll also talk to you about that. The 50 micrograms of tyrosine that you take, that's about, that's about how much someone would need. So let me back up a step. If you're taking as much as your body needs, you're probably not making any, if that makes sense. If you're taking 100% of what your thyroid would make by itself, then your output is probably pretty small and little, if any. Now, that 50 micrograms of tyrosine, that's T4, that's about how much you would need if you were roughly 60 to 70 pounds of body weight. So if you were that tiny and you were taking that 50 microgram dose, then you might not be making any by yourself. And that's one thing saying deprescribing is not impossible, but that's just one strike against its likelihood. That's probably, most adults are bigger than that. So you probably are making a lot of this by yourself already. And that makes it more likely for you. The scores that you shared are scores, some of the studies on deprescribing looked at the dosage people are on and looked at their scores going into it. And by both of those criteria, you are on the favorable side. the link I just shared about the article talked about both those things in more detail. But basically, those whose TSH scores are below 3 and those whose dose is below body weight requirements, they've got greater odds of successful deprescribing. And yeah, you would likely be in those categories. There was a large Korean study done. It was kind of a shocking thing. They showed that people on thyroid medication, that when it was the full amount their body needs versus the same people who didn't take thyroid meds, that there were more risks for mortality. So it's better to have your body make as much as possible. And that's more possible for more people than we ever thought before. So that was really good news. Okay, Dr. C with you. Big group tonight. Lots of you here. Happy to have you. I will be back. I'm expecting to be back next week. No scheduling plans for that to be off. So come on back and let's talk further. In the meantime, take great care of yourselves. And I'm going to go make an awesome supper for my lovely wife. All right. Bye-bye.